Finding a family doctor in Ontario is no easy feat, and it's about to become even more difficult. With an exodus of physicians during the pandemic and many now reaching the age of retirement, urgent action is needed to address the doctor shortage in Ontario. That's according to the final report from the province's COVID-19 Science Advisory Table.
This is the bedrock of our healthcare system. This is the foundation of the healthcare system.
A foundation that has been rocked to its core, with more people in search of a family physician now than ever before.
I feel for patients who are already struggling to find a family doctor. Keep looking.
As of 2020, 1.8 million Ontarians were already without a family doctor. In 2019, 1.7 million people were attached to a family physician aged 65 years or older and could lose their doctors to retirement by 2025.
Pre-pandemic, we knew that there was already a crisis brewing.
The primary care crisis deepened in the first 6 months of the pandemic when double the usual rate of family physicians closed their practices.
And that may have been related to hastened retirements, physicians who were at higher risk of contracting COVID-19.
More retirements and fewer graduates. A declining proportion of medical students are ranking family medicine as their first choice of specialty when applying to residency, from 40.2% in 2015 to 33.3% in 2022, the lowest since 2008.
If you've got people who have spent that many years at school, have got big debts, they're really looking to go into specialties that pay really well.
The shortage of family doctors will have a devastating effect on the rest of the already strained healthcare system.
We're basically putting the pressure on the hospital system to take up the shortfall. And what we already know is that the hospital system is at breaking point already. And when they get there, they're a lot sicker than what they would if we'd actually caught a lot of those issues much earlier.
When it comes to solutions, the Science Table offering a long list. One is to retain the existing primary care workforce through team-based care. The physician would no longer be the only point person, but would work with nurses, social workers, mental health counselors, and specialists to share the workload of caring for patients.
It really is becoming untenable for it to all fall to one physician to manage the increasingly complex care of primary care patients.
The Ministry of Health tells us in a statement, since the government took office, they have added 1,800 doctors in family medicine, and the next phase of their plan to stay open, they will add another 6,000 healthcare workers to the healthcare system. For City News, I'm Yazdani.